Welcome to the Riverbend Awareness Project.
The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
With these cancers being so rare, why do you feel it's important to still spread awareness and knowledge about them, even though it might not necessarily affect, someone you know or yourself, but it could still, go ahead.
Yeah, I think awareness is huge. I also think that these are more important to our society than their prevalence.
Mm-hmm.
because again, especially the bone sarcomas, these are happening in adolescents and young adults. And again, this is part of what attracted me to this field. It's like if you get a 2-year-old with acute lymphoblastic leukemia, it is devastating to the parents, devastating to the grandparents. It is an absolute, marathon of treatment. It's all these things. But that's happening to a 2-year-old. That 2-year-old does not understand it. They are not really, it's happening to them, but it's more happening to their family. And amazingly, and it's quite a blessing, but our success rates of treating things like acute lymphoblastic leukemia in kids are really high. Most of those kids are going to be fine and they're going to survive their cancer and they're going to go on to live good lives. You take sarcomas that are happening in kids that are mostly in their teenage years, and they are quite aware of what's happening to them. It is still, a tragedy to their parents and their grandparents, but it's also, these are people who are just beginning their lives, and they have not only a whole life of productivity and contribution to our society ahead of them, but they also are already contributing things to their community. And so it's something, when a teenager has a bone sarcoma, the whole town knows. In some of these small towns, if you're in a high school, like, you can't have a kid in your high school have a bone sarcoma and not know it. They get bald like me, only more bald. They get their hair back eventually, but and they're sick and they're puking their guts out for almost a year of treatment. So it's like a very, very public thing, and it matters. You can't see these people who are, again, adolescents just beginning their education, just beginning their work or whatever they're going to do after their education, or young adults that are sometimes new parents, newly identified a life partner, and they're like married, or they're beginning a family, and these are the people getting cancer. This is Breaking Bad. It's crushing to their world. And so I think our society cares about that situation a lot. We talk about it all the time. We talk about breast cancer, for example. We always talk about the young mothers with breast cancer. They're a tiny fraction of the women with breast cancer. Most women with breast cancer are older women, because that's when breast cancer is most incident. But sarcomas are like most incident in that young adult and adolescent population. So I think because of that, it is very impactful, on our society. These, although they're rare diseases, they matter because they're happening to what should be our most vibrant and productive part of our population. That's one thing. The other thing is just there is something about the exceptions and outliers that teach us a lot of things. I mean, I talk about these things quite a bit. I did there's a TED talk that I did more than a decade ago, um, about the role of these rare diseases in teaching us about common diseases. But it's absolutely true. I mean, you can first of all say a lot of what we know about cellular biology and organismic physiology, we have learned by studying cancer, because cancer is an outlier, because cancer makes biology broken a little bit. But a lot of what we know about biology we have learned because of cancer. A lot of what we've learned about cancer we've actually learned about because of sarcoma. I mean, and one, just like the easiest example is you think about, well, we know that cancer is a genetic disease, meaning that there are genes that are scrambled in the cells that become a cancer. We know that largely because of sarcoma. So not because sarcoma is common. I mean, I told you sarcoma is only 1% of all cancers, but we know about TP53, the biggest tumor suppressor gene, or gene that is turned off to cause cancer, because of sarcoma. So these doctors were seeing families where there were multiple sarcomas in the same family. That's bizarre. If you have a 1 in a million diagnosis, you shouldn't have multiple, two siblings with sarcoma. These families also had more breast cancer, more of other types of cancers as well, but they noticed them because the sarcomas. They noticed them because the rare tumor was suddenly common in these families. As this led them to sort of understand that these families were inheriting a risk for cancer, which led to the identification of the TP53 gene, and again, the idea that cancer had a genetic contribution of risk. If the other types of genes that are involved in cancer are called oncogenes, or genes that are turned on in a sort of unusual way to make a cancer happen. Well, the first oncogene that was really understood was through a type of sarcoma that was transmissible in chickens. So they found that these chickens got these sarcomas in a way that could be passed from chicken to chicken, and it turned out that it was in a virus that was delivering what then ultimately became known as the sarcoma, the Sarc oncogene. So even these things now, again, Sarc as an oncogene is not the most important oncogene in all of cancer, but it was the first that was really sort of understood, and it was understood because of these rare tumors. So I think in some other ways, there's a role for even these very rare diseases, because they teach us things about the biology of more common diseases.
Yeah, with sarcomas being much more prevalent in young people, do you know why that is?
There are lots of armchair theories, and since I'm sitting in an armchair, maybe I can espouse some of those. But basically, the leading thought I would say in the field is that we have most of our stem cells in these tissues that really are only growing when we're growing, and that after we stop growing, the stem cells in those tissues that are fairly stable in their cell populations for the rest of our lives, we start to lose those stem cell populations. And it's thought that maybe it is those stem cell populations that are this truly initiating sarcomas. When they get scrambled in their DNA, they are becoming the sarcoma. That's the thought, especially for bone sarcomas. You lose your bone stem cells by the time you're 25. You have very few left.
Kind of that idea that you talked about earlier with like the organs that the
Yep.
cells come back and refresh themselves all the time versus the ones that stop doing that to a certain point.
Yes.
Okay.
Yeah.
That makes sense.
Yeah. And does it have to do with proliferating cells or growing cells, or does it have to do with the stem cell populations that are supporting them? I don't know, but it's probably one of those two. And both of those are severely diminished after we become adults.
Sorry. I'm really bad at going on to the next thought because I like get sucked in and then I'm like, oh, this is cool, and then I'm like, oh, we've stopped talking now. Okay, on to the next thought. But with this unique cancer, what are some of the more unique challenges with it? Whether that be because of someone's age or even just are there different challenges physically, mentally that people face with sarcoma?
Yes, there are lots of challenges. Lots of challenges with sarcoma. And the first challenge is that not only are all sarcomas together a rare disease, but that 1% of cancer that is comprised of sarcoma is also comprised of about 100 different diagnoses. So 100 different specific types of sarcoma. And part of the challenge is that there may be some themes that are held through all cancers, like, TP53 is one of those sort of genes that is probably in some way turned off or turned down in almost every cancer. But there are other things that come down to our treatments that are really very specific molecularly, specific in lots of other ways. And so having 100 different subtypes of sarcoma makes it even more rare for each individual type. And probably we have to develop treatment algorithms for each individual type. And so as we are now dealing with very small numbers of cases in any single center of any particular type of sarcoma, it's even harder to make progress. So that's one very big challenge, and that is reflected most prominently in the fact that we don't have great systemic treatment options, meaning like medicines that you take, chemotherapy, immunotherapies, these types of things. For sarcomas in general, we are far behind some of the other types of cancer. We don't have things like, hormone treatment for breast cancer or prostate cancer. We don't have things like some of the target inhibitors that are so powerful for some types of lung cancer. We don't have, some of the immunotherapies that are so powerful against melanomas or other types of lung cancer, and frankly, a lot of other types of cancer. Most of those immunotherapies don't work so well in sarcomas. Some of them are, we have some early, limited success with immunotherapies, but in general, therapies are a lot less well developed, I would say, for specific types of sarcoma. I mean, we have very specific therapies that we use very consistently for the two types of bone sarcoma that happen in adolescence, but they're really almost the same as the drugs that we used for them first in the 70s. We haven't improved those very much. For one of them, we added a couple of drugs maybe 20 years ago. For the other one, we haven't added anything in 40 years. And so that is a challenge. Now, part of the reason why we haven't been successful in adding treatments to that regimen is because that regimen did pretty well as a first round, but pretty well was a little more than half are ultimately cured of their disease. That's not exactly settling. I don't think any of us are comfortable with, a little more than half of our teenagers that get this horrible disease surviving. Other challenges are simply in its rarity. Coming to diagnosis can be slow for some people. I think we all will put things off, and sometimes if something isn't causing that much pain, we might put it off for a while, and sometimes that can be dangerous. Um, so somewhat underdeveloped treatments and a somewhat slower process of getting to a medical attention leads to the fact that more of these patients are developing disease that is beyond what our best capacity is to heal them. Which our best way to treat sarcomas is if we can remove the entire tumor. In addition to, for soft tissue sarcomas, we're using radiation. For bone sarcomas, we're usually using chemotherapy. But still, in all those cases, we want to be able to remove all the tumor that we know about. And that is impossible to do once it has spread. So this a little bit slower, and then our inability to do very well at treating spreading disease are the two biggest challenges, I think.
Yeah, with some treatments being so rooted in the past, have you seen any big discoveries in research or treatment with sarcomas?
Oh yeah, I mean there are definitely discoveries happening all the time. It's it's slow to get them all the way from discovery through actual clinical practice. You know what I mean? Like, so I would say, the biggest improvement that we've seen in, the last 20 years is probably the use of these immune based therapies for a certain subgroup of sarcomas. This is mostly used for um, the soft tissue sarcomas, or things that happen in the muscles and tendons, and in the older population. So these are not the soft tissue sarcomas that happen in young adults, and that is and these are drugs that we see some substantial improvement in about a third of patients. So it's not amazing, but that's a lot better than when we had nothing that really had an impact on those patients 15 years ago. So that's one improvement, and I think that there are lots of other improvements happening in terms of our understanding of the unique biology of sarcomas. um, and I think that is going to be leading to treatment improvements, but it is slow. There's no doubt that it's slow.
I feel like that makes sense though with the rarity of it. Like it's not there's not as many cases of it to explore, examine. That makes it harder to be able to probably for research to continue.
It does. It challenges as much as as I said, in terms of our understanding of cancer biology, sarcoma has been like front and center. And in terms of our developing treatments, it's really hard to develop treatments when you only have a handful of patients of each type in each center. So they have to be collaborative efforts. They have to be you have to very carefully prioritize your efforts. You get to study like one thing. As a worldwide field, for any type of sarcoma, you can study about one thing every 2 or 3 years. that's what you get. Like you can't study 50 things at once like you could for more common types of cancer. So you have to be a bit more strategic, and you have to probably develop things further on the discovery and basic science side before they're ready to be what we call translated to the clinic.
Is there ways that people can help spread awareness or help someone who is facing sarcoma, what would you share that is like, if someone's listening to this podcast and they want to know how to help, what would you share with them?
Yeah, I mean, there are lots of ways to help. I think one is certainly, I think awareness helps. I think if you have a friend going through sarcoma, you probably know it. Um, and don't think they're weird, keep being their friend.
Yeah.
Like that's kind of a no-brainer,
Yeah.
but it is surprising how often I think people going through these treatments, again, especially the teenagers with bone sarcomas, because it's such a prolonged treatment course, some of them feel very isolated. And I think, if you know someone in your town, if you know someone who's going through that, like, reach out. And maybe you have to reach out by telephone because they might have a poor immune system right now because they're going through bad treatments that poison that. But still reach out. Like those are, you will be blessed by it. I can tell you, like, that is the best part of my job, is to be around these teenagers, that all of them rise to the occasion. I have yet to see one that doesn't impress and amaze me by the way they're facing these very difficult situations and still very bravely making decisions. So reach out to people who are going through any kind of cancer, but especially the sarcomas, just because they can be so isolating because they're so rare. The other thing is, you can contribute to sarcoma research. I do think that there's a role for that. Obviously, I have to be careful. I don't want to be self-serving here. I do a lot of sarcoma research, so I don't want to tell people like, oh, you should give money to me. No, I don't want your money personally. But there are lots of foundations that support sarcoma research. Certainly, our Huntsman Cancer Foundation here at the University of Utah supports sarcoma research. There's Sarcoma Foundation of America. There are a bunch of other organizations that support cancer research generally, many of whom also support sarcoma research. Alex's Lemonade Stand Foundation, St. Baldrick's. These are children's cancer foundations that certainly support a lot of sarcoma research. So I think those are ways that people can contribute if what they're interested in doing is contributing money or raising money. I mean, there are people who do fundraisers for different organizations that are raising money for cancer, and they do a local fundraiser to try to contribute to that. And again, those are welcomed, and your money will be put to good use by sarcoma researchers around the country and around the world, for sure.
Excellent. Well, we appreciate you so much for coming onto our podcast. And yeah, I hope everyone goes and checks out Dr. Kevin Jones.
Yeah, thank you. Is there anything we missed that you wanted to talk about that we didn't cover?
I don't think so. Thanks for having me on. This is great. I think anytime we can beat the drum about sarcoma and get more awareness out there, it's helpful.
Yeah.
I appreciate it.
I definitely learned a lot. Like, even like looking it up, trying to get, good questions, and then talking with you. And it made me think about too some of I don't think I've ever known anyone with sarcoma, but I remember there was a youth elementary school age person in our community where I'm originally from who had a battle with cancer, and just seeing his family and him go through it. He was the most amazing kid, the bravest, courageous. So, like, sorry, get a little teared up just like thinking like what you said. Like, their stories are amazing, and they're such amazing individuals, and the fact that this is a cancer that affects so many young people is very important. I think that we realize that.
Yeah, it is. People always say to me, like, how can you do your job? Like, how can you tell teenagers they have cancer. And it's like, yeah, that stinks on ice. There's no doubt. But I also get to see them and, get to coach them on their way into the ring with their head held high.
Mm-hmm.
And that's a humbling and just remarkable experience.
Okay. You can find more episodes of the Riverbend Awareness Project wherever you get podcasts or visit the Riverbend Media Group podcast page. Remember to share and subscribe.